So we're going to talk about the respiratory system. So the respiratory membrane, histological and anatomical structures. Um, the respiratory membrane or alveolar capillary membrane is where gas exchange happens by diffusion. And then histological components from air to blood. Um, alveolar epithelium. There's two types. So type 1 is the type 1 pneumocytes. These are thin, simple squamous cells, and they're at the primary site of gas exchange. And then there is type 2 pneumocytes, which are cuboidal cells, and those secrete surfactant, reducing surface tension and prevents collapse. Basement membrane. This is often fused between alveolar epithelium and capillary endothelium. It minimizes diffusion distance. Then there's capillary endothelium, which are simple squamous cells lining the pulmonary capillaries. Other structural features include alveolar macrophages for immune defense, elastic fibers allowing expansion and recoil, and a dense capillary network surrounding the alveoli. The functional significance is that they are very thin. There's a very thin barrier for rapid diffusion. Um, Large surface areas governed by Fick's law, that's increased surface area and gradient. Um, it increases diffusion, and then increased thickness decreases diffusion. So the mechanics of the respiratory cycle: inhalation and exhalation. Inhalation, uh, also known as inspiration, is active process muscular activity. The diaphragm contracts or it flattens. External intercostals contract. The ribs move up and out. Accessory muscles during deep breathing are the scalenes and the sternocleidoid mastoid. For expiration, quiet quiet expiration is passive process. That's when the diaphragm relaxes, elastic recoil of the lungs, and the thoracic volume decreases, pressure increases, and the air flows out. Then there's forced expiration, which is an active process. That's when the internal intercostals contract, the abdominal muscles contract, and the diaphragm goes upward. Then there's regulation of breathing, controlled by respiratory centers in the medulla oblongata and the pons. And then chemoreceptors is for the central and peripheral, and the peripheral is for O2, CO2, and the pH in blood. Oxygen and carbon dioxide transport and homeostasis. So oxygen transport, 98.5% bound to hemoglobin, oxyhemoglobin, and then 1.5% dissolved in plasma. Oxyhemoglobin dissociation curve, they are sigmoidal shaped, and they're influenced by decrease in pH, increase in CO2, higher temperature, and higher temperature. Sorry. It also promotes oxygen releasing in tissues. So carbon dioxide transport happens in three forms. So bicarbonate, carbaminohemoglobin, when CO2 binds to hemoglobin, and dissolved CO2. Um, Homeostasis regulation, um, it's maintained through respiratory rate adjustments, so pH buffering system, bicarbonate buffer, that's increased CO2, which increases ventilation, and then decreased pH, increasing ventilation, and then the kidneys. So, factors that influence respiration, diseases like asthma, pneumonia, and fibrosis. Asthma, that's a bronchoconstriction, uh, obstructing the airflow. Um, and COPD, that reduces airflow, and that's alveolar damage. Pneumonia is fluid-filled alveoli, and then fibrosis is thickened membrane, which decreases gas exchange. And of course, aging, that reduces lung elasticity, decreases vital capacity. Um, the lungs are less efficient for gas exchange, and sorry, reduced ciliary function, which increases infection risks. And then some medications like opioids, which lowers the respiration, or decreases the breathing rate for people. Sedatives, same thing, it lowers the respiration rates. Bronchodilators, that improves airflow. Um, Stimulants, which increase the respiratory rate. And then some injuries, like spinal cord injuries, disrupts neural control of breathing. Rib fractures can also impair ventilation. Brainstem injuries, that those can affect the respiratory centers. Um, Other factors include like exercising, smoking, and the altitude. So, like if you're in higher altitudes, it decreases the atmospheric oxygen, um, and then exercise increases your oxygen demand, and then that increases your respiratory rate. And then smoking, of course, does some damage, so damages the alveoli and reduces surface areas. And that's all I have for the respiratory system. Thanks for watching.